Safe, smart, and healthy. Keys to success in your new home. Medical care and health insurance. Three refugee families adjust to living in the United States. They each learn about the medical system in this country and what they need to do to get the medical care they need. Mrs. Lee has learned about primary care. Primary care is when you make an appointment to go to the doctor's office because you are not feeling well or to get a checkup. Mrs. Lee takes her young daughter to the doctor for a checkup. She is in very good health.
Come back and see me in 1 year.
Mr. Adam is not feeling well and would like to see a doctor right away. The office of the doctor where he usually goes is not open on the weekend or at night. He goes to urgent care. The urgent care office is open and can see him without an appointment. Mr. Adam has an ear infection. He must take medicine and follow the directions exactly.
You'll feel better in a few days.
Mrs. Ba has cut her hand badly while cooking. It looks like a severe cut. Her husband wraps her hand in a towel and drives her to the hospital emergency room.
My wife has cut her hand.
When Mrs. Lee used primary care, she called the doctor's office to schedule an appointment. Because she doesn't speak English, the doctor's office has provided a telephone interpreter. For scheduled visits, you must arrive at the doctor's office 15 minutes ahead of your appointment time. Bring your insurance card and any payment you are responsible for. If you cannot go to your appointment, you must call the doctor's office in advance to let them know. You can cancel the appointment or change it to another day. If you do not call and you miss the appointment, you may have to pay for the appointment anyway. Mrs. Lee took her daughter to their regular doctor for her checkup. This person is also known as your primary care doctor. Call your regular doctor for an appointment when you have a cold, flu, or minor aches and pains. Mr. Adam went to the urgent care clinic. Go to urgent care when you have more serious pain that cannot wait for a scheduled appointment during regular office hours, like an ear infection or sprained ankle or wrist. Mr. Ba took his wife to the emergency room because she was badly injured and her hand was bleeding heavily. Only go to the emergency room if your life is in danger, like a heart attack, stroke, asthma attack, severe burn, or a severe cut. If you cannot get to the hospital, call 911 on the telephone and ask for an ambulance. Do not go to the emergency room for minor aches and pains.
This cut will need stitches, but it will heal in a few weeks.
When you see a doctor, you have the right to have a professional interpreter. This language expert interprets everything you say and everything the doctors and nurses say, so that you understand each other perfectly. Providing an interpreter is the responsibility of the doctor or hospital. Requesting an interpreter will not cost you any extra money. Mrs. Lee's doctor provided an interpreter when they met for her daughter's checkup. The interpreter helped Mrs. Lee understand exactly what she needed to do to help her daughter stay healthy. Do not use your own family or friends as interpreters. This needs to be done by a trained professional. You cannot use any children as interpreters. When scheduling an appointment with any new doctor, be sure to let them know that you need an interpreter in your language.
Point to your language and we will get you an interpreter.
When you see a doctor, you will need to pay for your share of the visit. Even if you have insurance, you will usually need to pay some of the cost for yourself. It is important to show up on time for your appointment. If this is not possible, you must call 24 hours in advance to change or cancel your appointment. Mrs. Lee plans for transportation to make sure that she and her daughter get to the doctor's office so they will not be late. Bring all of your medical records with you. You need to keep all of your records well organized and stored in a safe place, because you will need them when you want to change your status from refugee to permanent resident. Make sure that your records show all the immunizations, tests, and other important medical treatment that you have received.
Do you have your medical records with you?
Most of the medical tests and treatment you need to change your status are provided to you free, beginning with your refugee health screening. When you want to change your status and become a permanent resident, if you don't have records to prove you had these medical tests and treatment, you will have to pay the civil surgeon to give you immunizations again. When Mr. Adam arrived in his new city, a resettlement agency caseworker made an appointment for him to visit a doctor's office and begin his refugee health screening. These visits to the doctor are to identify any health problems you might have that could interfere with work or school. We want your new life in America to be successful, with a good job for you and a good school for your children. If you or your family are sick, it will be hard for you to go to work or for your children to go to school. Mr. Adam took his medical records to the doctor's office. It is important for you to bring all the medical records that you brought with you on the airplane and show them to your doctor. You must tell the doctor about any sickness or other health problem you have now, or if you were ever sick or had surgery before you came to America. The refugee health screening includes many tests and shots. It also includes lead testing for children. It is very important that you remember to take your child back for a second lead test, 3 months after the first test. The doctor needs the results from both tests to keep your child healthy. When children or adults are exposed to lead, for example, from swallowing paint or dirt that contains this metal, it can be very harmful to them. Having even small amounts of lead in your blood, whether from breathing, touching, or swallowing lead, can cause brain damage, anemia, pain in muscles and joints, and other very serious health problems. Remember that checking your child's blood for lead a second time is very important to make sure they are healthy. It is important to participate in all parts of the refugee health screening. When the nurse provides you with a container to bring back a stool sample, it is very important that you follow the instructions exactly. The test is necessary to see if you have parasites or germs that can make you and your family sick. If the doctor or nurse discovers that you are sick or need further medical care, they will give you a referral. This means they will make an appointment for you to visit another doctor so you can get better. It is very important that you go to these appointments so you can get help for any illnesses or other problems you have with your eyes, ears, or teeth. These appointments are called follow-up appointments. You will need to bring your health insurance card to your follow-up appointments.
Do you have your health insurance card?
You do not have to pay for your refugee health screening, but all your other health care will cost money. The cost can be reduced if you have a government health insurance card or a health insurance card from your work. Mr. Adam has only been in America for 3 months. He still uses his government health insurance card. You have a government health insurance card for your first 8 months in America. After 8 months, you might still have a government health insurance card, especially if you have children. Mr. and Mrs. Ba have been in America for over a year and no longer have a government health insurance card. They have both found jobs at companies that offer health insurance for employees. If you do not receive a government health insurance card, you should try to find a job that offers health insurance. If you do not have any health insurance card, you should find a doctor's office that is low cost. Ask your caseworker for a list of low-cost clinics. Visiting a doctor without a health insurance card can be very expensive, and you would be responsible for paying the bills received from your doctor's office. If you don't pay those bills, it will be hard for you to buy a car or get a good apartment later on. Mrs. Lee and Mrs. Ba also go to an obstetrician or gynecologist. If you are a woman, you may be referred to one of these doctors. They are experts in taking care of women. These doctors can help you when you are pregnant, providing prenatal care. This is very important if you are going to have a baby. Your baby will be healthier if you have prenatal care. These doctors can also help with other health issues that only women have, such as menstruation or menopause. These health professionals and other doctors and nurses can help you with family planning. Family planning is important so you will only get pregnant when you are ready and can have only the number of children that you want to have. Mrs. Lee has chosen to have just 2 children and practices family planning with the help of her doctor. How many children you have is your decision. You have a choice about how much weight between one child and your next pregnancy. Talk to your doctor or nurse anytime you want information about family planning. Your children may be referred to a pediatrician by another doctor. Pediatricians are doctors who specialize in treating children. It is important that your children see their pediatrician on a regular basis so that they grow up healthy and strong. Remember to bring all of your child's medical records to the first visit with the pediatrician. Mr. Ba sees a doctor regularly to control his arthritis. You may be referred to a doctor if you have a chronic condition. Chronic conditions last for a longer time and include diseases such as high blood pressure, diabetes, and arthritis. They need to be checked by a doctor on a regular basis. If you have a chronic disease, it is important to see your doctor regularly so that they can check and see how you are doing. What you eat and drink and what medicines you take all have an effect on you. Be sure to tell your doctor about what you eat and drink and any medicines you take, including any vitamins, herbal supplements, and home remedies. They also need to know if you drink alcohol or smoke tobacco and how much.
Tell me about your diet. What do you eat and drink regularly?
It is common to need to see a doctor about pain and suffering you have in your head and your mind. Do not be embarrassed if you need to talk to someone because you are feeling sad or worried. Your previous difficulties can stay with you, and current problems can make it hard to sleep, give you bad dreams, or cause trouble in your relationships. If you have some of these feelings, it is good to talk to someone who is an expert in mental health. If you flash back to memories of the past, have regular nightmares, guilt or anger, or difficulty sleeping, you may need the help of a mental health expert. This kind of care might be provided by a counselor, psychiatrist, or social worker. It is important to get help so that you can go to work. Going without help can be hard for you and also your family. You will not be punished or taken away from your family because of asking for help with your mental health.
Medications and home remedies. Mrs. Lee is always careful when she uses medicines she purchased at the grocery store or drugstore. These are called over-the-counter medicines because you can buy them without needing a doctor's prescription. If you don't know the name of the medicine you need or have any questions, ask the pharmacist. This is a person with special training about medicines, including medicines that don't require a prescription. She always reads the directions carefully and only uses them for their intended purpose. Do not take more medicine than is indicated in the instructions. It will not make you feel better any faster. Be careful to read the instructions about giving medicines to children. Sometimes they need smaller amounts, a completely different version of the medicine, or shouldn't take it at all. If you don't get better after taking medicines you purchase at the store, go see a doctor. Other times, Mrs. Lee has gone to the doctor's office and been given a prescription by the doctor. A prescription is for medicine that will treat a specific problem you have. Make sure you tell your doctor about all the medicines or cures you are taking, including other prescriptions and home remedies. Some medicines you can only get with a prescription from your doctor. When you leave the doctor's office, you take the prescription to the pharmacy with your insurance card to get the medicine. Depending on what kind of insurance you have, you may have to pay part of the cost for each prescription. It is extremely important that you follow the instructions given to you by your doctor and the pharmacist who gives you the medicine. If you do not understand the instructions, ask for them to be repeated or request an interpreter. Take the exact amount of medicine that they tell you. Take it at the time of day they tell you, and continue taking the medicine for the number of days or weeks they tell you. Never share medicine with family or friends. A prescription medicine should only be taken by the patient it is for. If you have a bad reaction to a medicine, if it makes you feel worse, or you have an allergic reaction, stop taking the medicine and tell your doctor immediately. For example, if taking the medicine gives you breathing problems, chest pains, a rash, or stomach problems, this might be an allergic reaction and you should talk to your doctor immediately. If the prescription is for antibiotics, you must take all of the medicine you are given, even after you are feeling better. Finish all of the antibiotics. Only use antibiotics that you have gotten from a prescription from your doctor. Never use antibiotics brought from other countries by family or friends. When antibiotics are not used correctly, you and your children can become even sicker, and it will take longer to get well. If your prescription is for a tuberculosis infection or to prevent tuberculosis, you must take all of the medicine for the entire time of the prescription. Sometimes tuberculosis medicine is prescribed for 9 months. It is very dangerous to stop taking this medicine before using it all. If you do not complete all the months of medicine for tuberculosis, you can jeopardize your immigration status, and it will be harder to become a permanent resident or citizen.
Do not use medicine that is old or expired. It's important that you look at the date on the bottle. It will show the month, the day, and the year. If today is after that date, please throw the medicine in the garbage.
If over-the-counter medicines or your home remedies do not make you feel better, be sure to go see the doctor. If you have to take medicine during a longer period of time, you will need to go to the pharmacy and get more. This is called a refill. You can call your doctor's office and ask them to call the pharmacy with your refill prescription. You can then go directly to the pharmacy to pick it up. Be sure to always bring your insurance card to the pharmacy. Sometimes medicines are paid for by your government health insurance card or your work health insurance. There will be other times when you have to pay for medicine with your own money. Mrs. Lee needs her daughter to keep taking her antibiotics during the day while she is at school. She calls the school to talk to the school nurse. If your child needs to take medicine to school, you must contact the school nurse. If you are not comfortable speaking English, the school will provide an interpreter for you so that you can talk directly with the nurse. Your child should never take any medicine to school that the nurse does not know about. Mrs. Lee is careful to measure out the correct dosage for her daughter's medicine. Because children are smaller in size than adults, they usually need less of the same medicine. Follow the instructions for giving medicine to your children very carefully. Ask the nurse to show you how to give medicine to very small children and babies.
Substance use and abuse. Mr. Ba and Mr. Adam sometimes enjoy getting together to have a beer after work. They have learned about the laws in America about alcohol. You must be 21 years of age or older to drink alcohol in America. Mr. Ba and Mr. Adam are both old enough to drink, but must have identification to prove their age. It is very dangerous and illegal to drive a car if you have been drinking alcohol. For this reason, they make other transportation plans. If you are caught driving while under the influence of alcohol or other drugs, you jeopardize your immigration status and can be deported. Remember that some medicines can make you tired or sleepy and make it unsafe for you to drive. This is especially true of some pain medications. These can be especially dangerous if you drink alcohol while taking the medicine. Marijuana, cocaine, and heroin are all illegal in America. Using or selling any of these drugs will jeopardize your immigration status and you can be deported. Khat is also illegal in America. Using or selling this substance will also jeopardize your immigration status and get you deported. Some other intoxicating substances used in the country where you lived before may also be illegal in America, including natural substances or plants. Be sure to check. Tobacco and cigarettes are legal in America, but smoking is not permitted inside most buildings. Tobacco smoke is very unhealthy, not only for smokers, but also for their families and any other people who breathe smoke in the room because they are close to a person who smokes.
It's important for you to know that tobacco and cigarettes can cause cancer. Tobacco is bad for your family's health, including your children, especially if you smoke around them. Just breathing the smoke of your cigarettes can actually lead to respiratory problems and asthma, and it can actually lead to cancer.
Family issues and domestic violence. Some of the laws in America may be different than the country you lived in before. Women and men are legally equal in America. Domestic violence is illegal in America. Domestic violence is when one person tries to hurt, abuse, or gain power and control over another person through physical, sexual, emotional, verbal, or financial abuse.